Hi folks, this is John Adamson, the Rehab and Documentation Guru, and today is December 22nd, and I got a nice email from one of the viewers of my videos, and I'm just going to read the email and then talk about this as I go along. It says, "Dear John, I've been following your videos. I listened to them on the way to work." Thank you, I appreciate that. "They've helped me a lot. I have another question for you. I work in a SNF. I am the OT, so she's footing the bill for OT by herself. I had a patient who has uncontrolled diabetes and PVD. He broke his leg in June. Now, it doesn't say which leg, but he had an ORIF. He went to a rehab hospital where they worked on walking. He favored his ORIF leg. That's not a good situation. And obviously, people perpetuated that problem, the rehab facility. So he put weight on the other leg. He ended up getting a non-healing ulcer on his foot. After 2 months of wound care at home health, he ended up losing his vision and then had to get his leg amputated. Now, it doesn't say what level the amputation occurred at. He then comes to us. So he's in a SNF now. He now has no sensation from his buttocks down and no proprioception of his lower limbs. We try to have him stand, but each time he develops a bruise on his foot. Not wanting another non-healing wound, we made him a slide board transfer. He has to stay in our facility now because he cannot feel when he has to go to the bathroom and will not follow a timed schedule for voiding. No one is at home to help him with this. We discharged him as it sounds like a little wording issue here, but basically he was at his highest practical level, it sounds like. He now wants a prosthetic limb. The facility wants us to pick him up for a prosthetic limb training. Due to his lack of sensation, vision, proprioception, and the fact that his foot has bruised every time we try to stand, I do not feel it is safe or ethical for us to train him. As an OT, do I have to help him? And should the PTs even attempt this? What do I do about this?" Well, that's a really excellent case, Laura, and I have some very strong opinions that I believe are pretty solid clinically. So I'm going to talk about this particular issue. Obviously, this patient is in a really bad way. Notice he has uncontrolled diabetes and PVD. I'm going to assume he's had extremely high blood sugars for a very long time, and he probably has pretty extensive PVD. Now, the first thing I would probably do with this person is it sounds like his limbs are not in good shape at all. So obviously he's got an amputation on one side, whether it's below or above knee, I don't know. And then he's got the leftover limb, which is going to bear the burden. Now, one of the things that you'll want to do on this particular kind of patient is what's called a brachial ankle index. Brachial ankle index, you can Google this. It's free of charge to use. You do need a Doppler to do it. And I would encourage you to get the PT involved in this. So basically it involves lying a patient supine for about 15 minutes, just calm. Don't make them do anything. And then you take a systolic blood pressure in the arm, and then you compare it to a systolic blood pressure at the dorsalis pedal pulse. That you need the Doppler for. And you put the blood pressure you get in the leg, the systolic, above the systolic in the arm. So it's a ratio. Normal ratio should be 1.1 to 1.0. If the patient is 0.95 or lower, that is a definitive test for PAD. If they're below that, if they start getting below that, that becomes significantly concerning. Now, here's the other thing. Patients that have PVD, you would expect them to have claudication symptoms like pain problems. And in this case, because he's got peripheral neuropathy on top of this, he's got no sensation. He's numb. He's not going to be able to tell you if his tissues are ischemic. All of this situation is a bad situation. So first, let's objectify the PAD and find out just how impaired his limb is. And you can Google what the results of the brachial ankle index mean to the limb. And the fact that this guy's bruising on his foot every time, and she doesn't say the part of the foot, but I'm going to take a guess. I'm going to guess that based on the amount of lack of sensation this guy has, he probably has a collapsed medial arch. He has Charcot foot deformity, Charcot tooth, married tooth deformity. So he's got a collapsed medial arch of his foot, I'm going to guess, or pretty close to it. That is not the kind of limb you want to be pounding on the floor. Not a good idea. He can't feel it anyway, and you may cause a very serious break. You may cause a very serious injury to the tissue, and he could lose his other limb. The other thing that you got to keep in mind, if he's uncontrolled in his diabetes and he's got PAD, he's probably got a lot of cardiac insufficiency as well. I'd want to know things like, what's his ejection fraction? Is his heart even up to handling that kind of stuff? Because I don't remember the specifics. You can look this up, but a unilateral, aka amputee, expends more than 100% more energy just to walk than somebody with bilateral intact limbs. So he's going to have a lot higher aerobic capacity than a typical person. I'm doubting he's there. I just based on what you wrote, it is pretty clear he's in really bad shape cardiovascularly. And so that's not a good thing. Plus blindness. Think about that. When you have, what systems do you use for balance? You use somatosensation for one. That is the ability to have proprioceptive sense. Skin sensation. This guy has none. What else do you use for balance? Vision. This guy doesn't have it. And then that leaves you with only your vestibular system. And I guarantee he's impaired there. In fact, I would just, first of all, how's his hearing? Because we know that it's the vestibular cochlear nerve that helps you have hearing capability, and that's the same nerve that allows you to sense your balance from the vestibular system. So I'm going to assume he's got all three systems of impairment here for balance. So he's got a lack of afferent capability when it comes to balancing himself for being on his legs. Not a good situation. I would not even approach prosthetic training with this guy. It's from everything you said here, it is a useless proposition. And we are charged, according to the Hippocratic Oath, to first do no harm. And by putting him on his foot, which is already bruising, and trying to make him walk, we're probably going to do harm to his limb and maybe even his life, because if he develops a break and because of the lack of circulation, he ends up with a bone infection, and because he's got a wound also, or he develops a wound and he ends up with osteomyelitis and he loses that limb and he's already cardiac insufficient and he gets an amputation, he might not make it off the operating table again. And so this is a totally, it's not a good case to consider artificial limb for this patient. These are the kind of patients, when you look at him from the case study that you gave me, they're the kind that they get their prosthesis, they try it for a few days, and then it sits forever in their closet, several thousands of dollars of wasted money, and this, it's just not worthwhile. I'll just put it that way. It's just not worthwhile. Anyway, Laura, I just want to thank you for that great question. I hope this discussion has been helpful. Please feel free to send me ongoingly other case studies, because I love talking through these things. I think they're helpful to all. And if you've got some perspective on what I just shared, please feel free to bring it up in the comments section or suggest another video. Anyway, John Adamson, the Rehab and Documentation Guru, getting ready for Christmas, came out to do this brief video. Take care and God bless.